Hey guys, welcome to episode 7 of my Understanding Mental Health. I think in total there's going to be 13 episodes of the Understanding Mental Health, and this one is about schizophrenia. So in this episode I'm going to just talk in detail about schizophrenia and try and raise awareness for what it actually means instead of what it's portrayed by through the media. So I will talk a wee bit about how the media sees schizophrenia. So first off, I wanted to start off with the meaning. So it's a psychotic disorder which causes a range of psychological symptoms such as having a person's thinking, their ambitions and their behaviour being severely impaired. These symptoms could include, in some severe cases, hallucinations, delusions, which can cause a person having muddled thoughts and severe changes in their behaviour as well. They might not be able to see what is real and what is imaginary, so it does create that kind of delusion kind of format in somebody's head. They withdraw from interacting with other people and may not be able to look after themselves, whether this is like through personal needs or through grooming, like kind of washing themselves or making sure their face, like their beards and all that stuff are looked after, or might not even care about any hairs on their bodies when they're used to actually shaving it off. So that could be what the personal needs and grooming. So that's the kind of meaning of schizophrenia. So now I'm just going to talk a wee bit of how the media sees it. The media is mostly through misinformation. Most of the time they get schizophrenia wrong and sees it as something completely scary, I suppose, in a way. I don't see it as a mental illness and just see it as somebody being psychotic. So it is seen as a split personality according to media, which someone can go from being calm to completely out of control. I don't think it's as severe as that. But yeah, that's how it sees it. 36.1% of newspapers show schizophrenia as negative, 56.7% neutral, and only 7.2% positive. So it's not seen as positivity. So it does mean that some people read this and it drives a fear in them and they don't admit their issues or their problems or whatever. And they may think they're too dangerous to be dealt with. The reports say that people with schizophrenia are dangerous, if not in an institution with medication, which is not true at all. That's just how the media wants to convey it because it makes news and it scares people. Like I mentioned, it scares people into thinking that schizophrenia is something to be scared of, whereas it can be treated and it can be the severe cases could be limited. So it is possible to deal with schizophrenia, and I'll get onto that as the episode goes on. So it's people with drug and alcohol problems, like alcoholics, druggies and that, they're more twice as likely to commit a violent crime than someone with schizophrenia, which not many people know. The media kind of sees that as, they kind of see schizophrenia as people who are most likely to commit violent crimes, when it's actually not true at all. They're more likely to injure themselves than anybody else, so it could lead to self-harming, suicide and that. But this is because of having voices in their head convincing them that that's the right idea, that's the right thing to do. So yeah, people with schizophrenia and any other mental illness may not be willing to come forward and get the help they need, as they feel they might be judged might be considered a psychopath, or as people call it, schizo, and seen as an outcast. So these people are dealing with this in silence, and they don't deal with it. So they become worse and worse, leading to worse severe symptoms for certain people, and then by that time they might not be able to get the help that they need. So media does have a really negative aspect into how schizophrenia actually is. So possible causes, there's many, but there's no clear answer. There is a combination of stuff. Could be excess dopamine. So dopamine is a chemical that carries messages between brain cells. Not quite sure how someone can get too much dopamine, which could lead to schizophrenia. So that'll be too many messages are going, and not being able to deal with it, and that's how the schizophrenia kind of kicks in. Stressful life events, again, I've explained it before in the past videos. There's triggers. Everybody's got a trigger. It could be losing someone, being homeless, not having a job, abused. So this could lead to stress, which could lead also to schizophrenia as well. Drug abuse, cannabis or other street drugs can develop symptoms of schizophrenia. If somebody takes a heavy dose of cannabis, they're 6 times more likely to get schizophrenia than anybody else. So drugs is a major cause of schizophrenia, and not many people know that. You're also likely to get it from genetic inheritance. Again, in the past videos I have to explain that. So if your parents have got it, you're more likely to develop it yourself. But there are ways that you could probably deal with it and deal with symptoms before they become really, really severe, which I will be talking about later on, like treatments and resources and everything like that. Brain damage, if somebody's got an injury to the brain, that can also link to schizophrenia as well. So yeah, so that's the possible causes of schizophrenia. Not many people know that it's more than just developing it. It's quite a lot to do with the brain. So yeah, so I've got the feelings that some people may experience, so that others who know someone with schizophrenia can actually say, alright, well, okay, that's how they're feeling, and they'll understand a wee bit better. So they don't want to look after themselves or look after or do their education, which could lead to difficulty in employment, which could lead to not having a job, which leads to not having money, and that could make them feel even worse, could lead to depression, could lead to suicide, could lead to anything like that. They find it difficult to plan or organise anything, quite like bipolar. 1 minute you could feel like you could do this, and the next you feel like you can't. It's just like that. Develop memory problems or OCD as well. OCD is another episode that'll be coming up in the next few weeks. So that does lead to that. So there's other ones here: delusions, false beliefs, feel someone might be following them or try to kill them or whatever. That's the kind of severe cases. Hallucinations, they hear, they see, feel, smell or taste things that are not real. Hearing voices is the most common out of these. So they might have arguments with the person, but obviously they're having arguments with the voices in their head, but they're not having arguments with people in real life, if you know what I mean. Disordered thoughts. These thoughts could become jumbled or blocked. Thoughts and speech may not be logical, might struggle to talk, and might struggle to talk about the feelings and everything like that, because that's what schizophrenia does. May believe their thoughts are being read by other people. thoughts being removed, all that kind of stuff. There's quite a lot about thoughts. I've only put a couple of examples in, but someone with schizophrenia, their thoughts comes into it quite a lot of the time, and it's that's what one of the major, how they feel. That's one of the major things that is talked about in the unit. They might have a lack of motivation. The concentration might be poor. Might not want to do anything. Might not want to, like I said, get an education and everything. Their feelings might change. They might become flat. And that's the feelings that they could have. There's so many different other ones. This is just some that I wanted to go into. So yeah, but it could affect their life as well in major ways, like their relationships with partners. Partners might not understand, so they might just say it's too much for them. Risk of suicide attempts, again, I've kind of spoke about that, where schizophrenia could lead to depression because they can't get a job or anything like that, and so they feel like they're useless. So they might try and commit suicide, or might be a risk to suicide attempts. Might have problems with drug abuse and alcohol. Again, I kind of spoke about that before. They might struggle with normal day-to-day activities just because they feel like they can't do it. So yeah, might struggle with their concentration. Again, that's something I've mentioned as well. So it can affect somebody's family and friends as well. It could push them away. The family and friends might become frustrated and angry mostly because they might not understand properly what schizophrenia is, or maybe they feel like the person's putting it on a bit, so they might get annoyed with that, and again that might lead to fallouts and everything like that, and then they won't have their family with them or supporting them. So there is possible interventions for people. So the aim is to reduce relapse or symptoms. So I've got a couple of different types here. This is kind of like how to stop it becoming really, really severe, or if it is severe, then this is how to stop through like kind of medication and everything like that. So there is antipsychotic medication. So this relieves most of the troubling symptoms such as delusions, hallucination, thinking problems like your thoughts and everything, which I explained earlier. Hospitalisation, that's just to get back in a stable condition, make sure that they're okay, make sure they can deal with everything like that. Electroconvulsive therapy, ECT, I've spoken about this before in previous episodes. It's something that comes up quite a lot actually, because this is a way that kind of deals with mental illness, and it must have, I'm not too sure if it does work or if it doesn't, but it is an option. So this is attaching electrodes to person's head and a series of electric shocks to the brain, but it's hardly used. I've just seen that in my notes there. So, and there's also psychological treatment, which is therapy, social skills, job training, help to understand it better. There's so many different types of treatments for people, which I will probably go in greater detail in a few minutes. So there is ways that individuals can manage their own illness. This is like going through like self-help groups. Talking to people, understanding it might help people go, okay, well, this is how they deal with it, so maybe I could try that. Self-help, just to look after themselves as well. Avoid undue stress. Again, look after themselves, but this is like personal grooming, hygiene and all that stuff. Making sure that they're okay. Taking care to look after themselves as well, because not many people do. I know a lot of people that don't. Being able to identify that their trigger and avoiding it. So if there's like problems that abused or something like that, then try and not think about it, or try and make sure that you don't go near the trigger and that'll help avoid it, so it will. Others, like family and friends, they can help. They can learn about the mental illness and encourage a person to get help, but also not to get frustrated as well, because if they get frustrated, then that could lead to the person becoming frustrated and might lead to kind of severe symptoms. I've got a few resources and treatments here as well, and then I'll finish up the episode. So resources: health centres communicate referral to the CMHT, the Community Mental Health Team, who will help find better accommodation and better help for the person, whatever they need. Occupational therapists, support workers, social workers, community psychiatric nurse, who just goes out and checks on them. Going to support groups as well. There's many different types of resources in the community for people with schizophrenia. There is treatments as well. Again, this is kind of stuff that I've kind of went over a bit, like antipsychotic medication, which helps the symptoms. It stops the symptoms becoming more severe. Going to the GP, they could recommend different options for the person, which is best for them. Hospital care, environment of care as well. There's talking therapies, so psychotherapy, counselling, or cognitive behaviour therapy, CBT, which kind of helps. I've explained that in episodes before as well, where you kind of talk about a more of a positive spin on things and looking at the positive side. And this will help identify the problems for people that don't actually have the help. That don't actually have the help 24/7. So that's me. That's schizophrenia. It was a really interesting topic when I did it. I didn't know that much about schizophrenia. Except from what I've read and everything, like in the media and all that, you just see it as something that's really, really bad. Whereas there's a lot more to it than just somebody being described as a psycho, pretty much. So sorry I've not posted for a wee while. I've just been really, really busy, been hectic. I'm hoping to get another episode up within the next few days. The next episode will be about eating disorders, so I will have that. And also next week, sometime, most likely the start of the week or something, I'll have one of my friends on talking about anxiety. So we will be doing that next week sometime, and I'll be posting that up, and then that'll be another 2 episodes done. And yeah, so I hope you enjoyed that. I hope you learned something. I hope you know that schizophrenia is not as bad as everybody makes it out to be. And thank you very much for tuning in, and I hope to see you very soon.